There are a number of different things that can cause heavy menstrual bleeding, but I'm mainly going to focus on three different diseases. So endometriosis, fibroids, and adenomyosis. So endometriosis is defined as endometrial tissue that exists outside the uterine cavity. So it could be on the outside of the uterus itself, it can be within the fallopian tubes, and it can also be within the ovaries itself, and it can sometimes cause the development of cysts called endometriomas. Fibroids are benign tumours of the uterine smooth muscle that can make periods heavy and painful. And adenomyosis is when endometrial tissue is found within the myometrium and it causes really painful periods. As for the investigations and management, first of all, an ultrasound scan would be recommended because they may be able to identify certain abnormalities like fibroids. In the case of endometriosis, that can't necessarily always be picked up on an ultrasound scan, so diagnostic laparoscopy may be considered, but much of the time it's just treated empirically and the symptoms are managed as best as possible. So the pain from endometriosis can be managed using NSAIDs like mefenamic acid. You can also use things like the combined oral contraceptive pill and progestogens to try and gain control of the periods and hence reduce the impact that they have on the patient. There's a few niche things like GnRH agonists and danazol that may be used, however that tends to be relatively rare. There are a few surgical measures that can be considered as well, so endometrial ablation or excision of various bits of endometrial tissue may improve symptoms. And in patients for whom fertility is no longer a concern, then a hysterectomy with bilateral salpingo-oophorectomy may also be considered. Fibroids management is kind of similar, so tranexamic acid can help reduce bleeding in the short term, NSAIDs again to manage the pain, the Mirena, so the levonorgestrel intrauterine system, can help make the periods less heavy and less painful, and similarly the combined oral contraceptive, progestogens, and ulipristal acetate can also help gain some control. The surgical management depends largely on where the fibroid is, how big it is, and where it is in relation to the myometrium. So some of them will be on the inside part of the uterus, they might be right in the middle of the myometrium, and some of them may be on the outside. So there's a number of things to consider before determining which of the options listed is best for the patient. For adenomyosis, again, it's about symptom control, so the Mirena can help reduce the severity of that pain. Tranexamic acid can help with the bleeding, NSAIDs for the pain, and similarly the oral contraceptive and other pills can help. In severe cases, endometrial ablation and hysterectomy may be considered. So you can see that there is a lot of crossover in the management of the different forms of heavy menstrual bleeding, but a lot of it revolves around trying to manage the pain as best as possible and also to try and make the periods less painful and less heavy. One final point I want to make is that according to the guidelines, if fibroids are less than 3 centimeters in size, then the management is as per adenomyosis. It's only if the fibroids are greater than 3 centimeters that the fibroid arm of this flowchart is followed.